Now we are going to be studying about the lab diagnosis in meningitis. Okay, so laboratory diagnosis in meningitis. So in this video I'm just going to be teaching you the lab day of meningitis. If you want to see details of meningitis, please see my previous video. You'll understand everything which is important for you. Okay, so now what is the lab collection, the samples which are need to be collected in the diagnosis of meningitis? Okay, so specimens, the most primary specimen is going to be the CSF. CSF is analyzed to confirm the clinical diagnosis. Okay, so helps in clinical diagnosis of meningitis. Okay, so how will you collect CSF? The CSF is to be collected with the help of a lumbar puncture. Okay, CSF to be collected with the help of lumbar puncture. Okay, the sample should be transported immediately. Sample to be transported immediately. Okay, and it should be kept in a temperature of 37 degrees Celsius or at room temperature. Okay, now the second specimen which you can take is blood. Blood is collected for, why would you collect blood? Blood is collected for culture examination. Okay, blood is going to be collected for culture examination. You can isolate pyogenic meningitis causing bacteria. Okay, so pyogenic meningitis can be cultivated. Okay, nowadays these are to be collected in different bottles. So both blood and CSF should be collected in different bottles for automated cultural systems. Okay, so blood, CSF and blood to be collected in separate automated control bottles. Okay, so which systems are used? Back or back T alert or back T alert. Okay, now what are going to be your laboratory examinations which you're going to be performing? Okay, laboratory examination of CSF. Okay, so we're going to be doing different studies or tests, like we're going to be doing cytological study, biochemical test, microscopic examination, culture examination, and then detection of antigen and antibodies. Now we're going to start with the first, which is going to be cytological study. Why it is done? To confirm a diagnosis of meningitis. Confirm meningitis diagnosis. Okay, What is the normal CSF count? Normal CSF count is normal CSF count of bacteria is 1 to 3 cubic centimeter. Okay, now in acute meningitis, the cell rise is going to be 1000 to 10,000 cubic millimeters. Okay, and the predominant cells are going to be your neutrophils. Okay, in tubercular meningitis, the total cell rise will be 50 to 500 cubic millimeters, and the predominant cells are going to be your lymphocytes. And similarly, in viral meningitis, the total cell rise is going to be only 10 to 100 cubic millimeter, and the predominant cells are going to be lymphocytes. Okay, so in cytological study, we're going to do it is for confirmation of meningitis. In acute meningitis, your total cell rise will be 1000 to 10,000 cubic millimeters. In TB, 50 to 500, and in viral, 10 to 100. The predominant cells in acute meningitis is neutrophils. In TB, it's lymphocytes. In viral, it's also lymphocytes. Okay. Second, we're going to be doing is biochemical test. Why? Because in case of meningitis, there will be increased total protein and your sugar will be decreased. Okay, sugar decrease, total protein increase in CSF. Now we're going to be doing microscopic examination. So I'll be just telling 4 stains which we do for specific meningitis. Okay, so we're going to be doing gram stain, which is for pyogenic bacteria. We're going to be doing Zn stain, which is for tubercular meningitis. We're going to be doing negative stain, which is for Cryptococcus neoformans. Which stains are included in this? So Indian ink, and it's going to be necrosin. Okay, and the last is going to be wet films. Wet films are for detecting parasites. Okay, so microscopic examination. Now we are going to be doing cultural examination. Okay, so which culture plates we are going to be using? Plates or mediums which are used, these are going to be blood agar, chocolate agar, and McConkey agars. Okay, they are going to be inoculated and incubated at temperatures of 37 degrees Celsius in a candle jar. Okay, now once you keep them in a candle jar, you're going to be centrifuging them, and to avoid contamination. Okay, so now we are going to put them in culture plates after keeping them in their mediums. Now 1 to 2 ml of CSF is to be inoculated in a liquid medium. Okay, so 1 to 2 ml to be inoculated in liquid mediums, like you can put them in glucose broth. By this you can show even minute growth of bacteria also can be shown by this liquid mediums. Okay, now we are going to study detection of antigen antibodies. Okay, the fifth is antigen and antibodies. Okay, so which organisms can be detected by antigen? So you can detect meningococci, you can get Haemophilus influenza, you can go pneumococci, or even Streptococcus neoformans. Cryptococcus. So we are going to be revising lab D. So we are going to be doing cytological study, biochemical test, microscopic culture, and antigen antibody. The sample which we collect is CSF and blood. In cytological, we do the total raised cells count, like 10,000 to 1,000 in 1,000 IQ meningitis, 50 to 500 in TB, and 10 to 100 in viral meningitis. Biochemical test will show increased total proteins and decrease sugar if there is a diagnosis of meningitis in a patient. Microscopic examination, you do gram stain, Zn stain, negative stain, and wet films. Culture examination, mediums which are used are blood agar, chocolate agar, macogni agar, which are to be kept in candle jars at room temperature or 37 degrees. And another is to be done at 1 to 2 ml, which is to be inoculated in liquid mediums. Antigen antibody is for detection of meningococci, H influenza, pneumococci, and Cryptococcus neoformans. Antibody detection for ELISA and immunofluorescence test. The tests these are done for HSV, Japanese encephalitis, and T. pallidum. Okay, thank you, and your meningitis will be completed in these two videos. Bye and have a nice day.